PMS can often make depression worse. It can exacerbate any of these existing feelings of unhappiness we may have and can make a clinical diagnosis of depression worse too. But very rarely does PMS itself actually cause clinical depression. So let's have a look in more detail at this link between PMS and depression, and let's see what can help too. The phrase "I'm depressed" is often very loosely used when we're feeling a bit low or down, and maybe when we're facing a stressful period in life. So it is important to distinguish between these changes in our mood, which are part of the normal experiences we face from time to time, and then true clinical depression, which is sometimes associated with chemical imbalances in the brain, other times with trauma and many other things as well. And it can obviously severely affect the emotional well-being of a person. But PMS is rarely a direct cause of depression. It's normal for our energy to be a bit lower before we bleed and for our mood to change. And often these changes in mood premenstrually can give us some great insight into the things in our lives that may need to change. So, it can be helpful. But PMS can certainly make someone who's already feeling down or depressed feel worse, and can potentially have a big effect on this sort of more ongoing issue. So a good question to ask yourself is this depression going away completely after your period, or is it still there and just not so bad? Because if it's an ongoing issue, this PMS depression could actually be a great sign from your body to get the support you need for the depression. So what treatments are there out there for depression? If you're suffering from clinical depression, especially when it's not associated with PMS, you should definitely go to see your doctor. They'll ask you about your symptoms, when they occur, how they present. If you have a family history of depression, they may also ask you whether you have suicidal thoughts. They will often prescribe medications, the doctors, that's what they do, like say antidepressants, which do help some people, but they don't work for everyone. And if you mention the fact that the depression is linked to your period, they'll likely prescribe the pill, which isn't really going to help. It'll mask symptoms perhaps, but in some cases it does make depression worse. So good to know there are other options available, I guess, and things you can ask your doctor about if they aren't immediately offered. This includes cognitive behavioural therapy, or CBT, which is a talking therapy that focuses on altering your approach and outlook and your responses and reactions to different situations. Bright light therapy is another option, which is particularly helpful in the winter. If your depression is a bit seasonal, you get exposed to certain frequencies of light in order to boost the production of serotonin and then limit the production of melatonin, which raises your mood. And then things like exercise and dance and singing, time in nature like forest bathing, these things have all been shown to help with depression too. And of course, seeing a herbalist alongside your doctor could help as well, or a nutritionist. Food intolerance actually often show up as depression, or you could see a naturopath like me who addresses diet and lifestyle as well as offering herbal medicine. When it comes to herbal medicine for depression, though, I wouldn't recommend self-medicating with herbs. If it's an ongoing issue, definitely book an appointment to see a herbalist, especially if you're taking medication, because a lot of the herbs can interact with those medications. But herbalists can work really well as complementary therapists. So if you're seeing your doctor and still need more support, definitely seek out a herbalist or a naturopath who will work with you alongside your doctor. But if the low mood is kind of only showing up during the week before your period, and is definitely PMS related, you could definitely try Agnus castus to help rebalance those hormones that are associated with PMS, especially if you have other symptoms of PMS like breast tenderness and bloating and irritability in there as well. You could try magnesium too, maybe cut down on the sugar and processed food as well as alcohol. Hypericum then, which is St. John's wort, is another herb that can help low mood, but it's a tricky one to self-prescribe with. You just need to know basically that it's not suitable if you're taking any medications. It speeds up the detoxification pathways in your liver and can make the medication that you're taking ineffective. It is available in the UK from health food shops, but in Ireland you can only get it from licensed practitioners for this reason. Lastly then, if you are feeling suicidal, if you need to talk to someone, you can always call the Samaritans. Their number is 116123, and just please know that you're not alone. If you have any questions, please do let me know in the comments, and I am wishing you all happier periods and happier lives in general.